Fellow Namibians, good afternoon. As you are aware, government is seized with ongoing efforts to mitigate the spread of COVID-19 in our country. The health situation remains dynamic, requiring equally dynamic interventions to suppress the risk of exponential spread of this disease. I thank each and every person who has made sacrifices in the fight against COVID-19. Those sacrifices have been difficult to endure, especially the economic hardships. Although we are managing the coronavirus in Namibia, we all remain vulnerable. We have not defeated this virus yet, and the battle is ongoing as new cases continue to be reported. Although we are experiencing great socio-economic challenges, we have yet to experience death as a result of COVID-19. As leaders, we will continue to do everything in our power to limit the impact of this pandemic. As of 7th of June 2020, Namibia has recorded 29 confirmed cases, of which 8 cases are from Erongo Region. 7 of the cases were reported within the last 2 weeks. Case number 21 is that of a truck driver who breached quarantine regulations and may have been in contact with other members of the community. 59 contacts have been identified so far. Tracing of contacts was initiated and is ongoing. It is a meticulous process to ensure that no contact is left unidentified and untraced. Case number 22 is that of the fish trader who plies the seas between Namibia and the Democratic Republic of Angola. He is currently admitted to a private health facility in Walvis Bay under intensive care. He has had contacts with various members of the community. This poses a possibility of the transmission of the virus to others. Contact tracing has also commenced and is ongoing. Case number 26 is that of an employee of the private health facility where case 22 is admitted. This case too has had contact of several people in and around Walvis Bay. So far, 15 contacts have been identified and traced. If not handled correctly, this could increase possibilities for community transmission of the virus. The risk profile for the spread of COVID-19 in Erongo Region warrants specific attention. Furthermore, based on observations regarding the current lockdown in Walvis Bay local authority, members of the public are not adhering to the lockdown measures. Therefore, the potential for community spread and the risk level for Walvis Bay and surrounding towns is high. This necessitates more stringent measures to curb spread beyond Walvis Bay. For these reasons, I hereby inform the nation that Stage 1 restrictions will be extended to the entire Erongo region for a period of 14 days, effective from midnight tonight, 8 June 2020, until midnight 2022, June 2020. This time will be utilized to conduct expansive testing in the area surrounding the known cases. The Ministry will also expand the search for contacts of secondary contacts. We are working to avoid imposing national lockdowns by effecting prompt and targeted localized interventions. We know that elderly Namibians are more vulnerable to this virus. I therefore direct all old age homes in the Erongo region to be placed under isolation. Caregivers should have the appropriate personal protective equipment. As a result of steps already taken, Namibia has the opportunity to contain possible community transmission within identified geographic areas and prevent the uncontrolled spread of infection throughout the country. We aim to possibly stop the spread altogether through effective detention, quarantine, testing, and treatment. I understand the economic hardships we are facing as a nation and devastating, it's also devastating, but I am convinced that cause of inaction, allowing the virus to spread unfettered through our communities would be even more devastating. The restrictive measures are temporary, and I ask each and every resident to work with the authorities. If we lose control now, these measures will be put in a more complete stage. So I would like to once again ask all of us to comply with the regulations, to listen to the authorities, especially frontline workers, so that please, we don't have to fight over this, to push each other and so on. We are not at war. Police are not at war with our citizens. We are doing this to safeguard the lives of our people. So if we can cooperate, all of us, and work together, I think we will save lives. So far we have been doing very well, and the world is praising us. But we are getting our people to come back from where they were. And they are the ones who are bringing this disease. We cannot stop them from coming home. We must contain them. And they must cooperate, all of us. We are doing this in the common interest of Namibian people. We don't want to punish anybody. Why? So please, cooperation is necessary so that we can address this pandemic. I thank you. Minister of Health may just a little bit add, and maybe the other regulations could maybe later on by Attorney General. But Minister, if you can just supplement here and there.
Thank you very much, Comrade President, Comrade Vice President. I was going to indicate the guidelines during lockdown. I'll do so very briefly, since most of the guidelines were already explained to the public during the first lockdown. There are some minor changes dependent on the development as we see them at the present moment. As has been explained by His Excellency, the lockdown will begin tonight, 23:59 on Monday tonight, until the 22nd of June, as has been explained by His Excellency the President. Just to say that the following people, they are exempted from the lockdown. In other words, the lockdown means you stay where you are. But the following persons, they are exempted from this regulation. The health workers in the public and in the private sector, emergency personnel, security services, and all persons who are involved in the production, distribution, and supply of goods and food across the agricultural value chain, the fishing, essential legal, financial, and banking services. The maintenance of power, water, and telecommunication services, laboratory and veterinary services, refuse removals, provision of medical and hygiene products, cleaning services, aircraft and cargo handling and engineering, park wardens, mining, informal traders, social welfare services, humanitarian workers, and the media. They are all exempted from the provisions of the lockdown. All the residents in the Erongo regions, they are not allowed to leave their homes during the lockdown period unless such movements by any person in the restricted area is for the following reasons. Travel by persons listed in Section 2, as I mentioned above, visits to pharmacies, food supply stores, courts, banks, and for medical reasons. I should also mention that physical exercise in group of more than 3 persons is not allowed. Only one person from a household may visit a store for essential goods and service at a time. Inside a store, all shoppers must strictly adhere to the prescribed social distancing protocols, keeping a distance of 1.5 meters or more from another person. You only leave the house, that is now people in the restricted area, when it's absolutely necessary, for example, to get food, seek medical care, or access to essential services. Not more than 3 persons will be permitted in a 4-seater motor vehicles. Not more than 4 persons will be permitted in a 7-seater motor vehicles at any given time. For larger buses with carrying capacity of 16 persons or more, may only load half the number of the passengers. Which business and service will remain open? Most shops and business will be closed, except those classified as essential or critical services. The police, military, and emergency services will continue to operate. Healthcare services such as public and private hospitals, clinics, doctors, pharmacists, and laboratories will remain open. Banks, essential legal, financial, payment services, and medical aid funds will continue to operate. Supermarkets and home kiosks will be allowed to operate normal trading hours daily to allow residents to provide care for themselves and their families. The sale of alcohol, liquor, and spirit is strictly prohibited. Petrol station and the forecourt shops will remain open 24 hours. Municipal bus services will be suspended except for those supporting COVID-19 response. All open markets and informal trading activities will not be allowed to operate. Shebeens, bars, pubs, nightclubs, casinos, and gambling houses in the whole of Erongo region will not be permitted to operate during the lockdown period. Restaurants, cafes, and coffee shops will remain open, but only offer takeaway services. Entities essential for the production and transportation of foods, basic goods, medical supplies, and their support services will be allowed to operate. And banks are encouraged and urged to optimize electronic banking channels. The government urges employers to assign employees to perform their tasks from home in as far as the performance of such tasks from their home is possible. Where the service is essential or critical, employees may be required to come into work. Where the service is not classified as essential or critical, employees will work from home. Employers should exercise strict caution and ensure only a minimum number of employees are brought or remain on site to guarantee that the provision of essential or critical services is not disrupted. All employees working during this time should observe strict hygiene and adhere to prescribed social distancing protocols at all times. Wearing of face masks is compulsory in all public space and within the working environment as far as practical. Travel to the restricted area is prohibited except for persons providing essential services or for emergency purposes. Namibians and non-Namibians may enter the restricted for the purpose of humanitarian aid work and essential or critical services as defined earlier. Foreign nationals currently in the restricted area planning to return to their respective country of origin will be permitted to travel back at own cost. All returning citizens and permanent residents will be subject to mandatory supervised quarantine for a period of 14 days. Facilities that satisfy the minimum standard as prescribed under the national guidelines will be identified and reserved for the purpose of quarantine. And all persons identified through contact tracing will be placed under supervised quarantine for a period of 14 days. Now, when it comes to gatherings, any gathering during this period in the restricted area shall not exceed 10 persons. This includes weddings, funerals, and religious gatherings. The COVID-19 related funerals will be handled by the state. And for the non-COVID related funerals, organizers are advised to limit the number of attendees to not more than 10 persons. Those required to travel outside the restricted area for reasons of emergency may seek authorization from the regional director of the respective sectors. Social distancing protocols should be strictly adhered to in all public space. It is the responsibility of us all to minimize our movement and avoid large crowds. We call on everybody to cooperate with the government to implement these measures. Violating any of the lockdown regulation is a punishable offense. A person who violates is subject to a fine of 2,000 Namibia dollar or arrest. Our social safety net benefits remain in place and disbursements will not be disrupted. Service providers must ensure appropriate social distancing protocol at all pay points. All channels for access will remain open, including ATM, retail points of sale, and cash points. This is a call to the public that we are all in this together, and if we are working together, we'll emerge stronger together. There is a special fund which has been existed since the beginning of the lockdown, to which individuals and institutions can make a contribution. As has been stated by His Excellency, The testing will be actively pursued. And there is no need to stockpile food, and we call upon everybody to avoid panic buying. We can always provide credible information through our communication center. Before I conclude, I would like to share with the public the general information that the urgent and aggressive measures we are taking will challenge us as a nation. But we are convinced the cost of not acting now would be far greater. The lockdown of Erongo regions will be accompanied by continued public health response to provide screening, testing, contact tracing, quarantine, isolation, and medical management. We are all encouraged to be active and exercise within our home environment. And it is encouraged that we stay all connected via phones, social media, or emails. Practice hygiene when you go out. Wash your hands when leaving home, and again before departing for home. Carry hand sanitizer at all times. Avoid touching your face. By staying home, we are contributing greatly to the fight against the further spread of the disease. These measures will be reviewed regularly as we scale up our national response to COVID-19. During this time, let us all demonstrate the value of solidarity, unity, and empathy. Let us give ourselves and our time by volunteering to assist all those involved in the fight against COVID-19. The more we observe these measures, the earlier we can get out of the lockdown. We have, in my statement, there are two appendix. One, elaborating more of what is essential service as defined by law, and the second one, also the list of critical economic services which you can access at your own free time. I would like to thank Your Excellency and end my intervention here. Thank you very much.
Thank you. Is there any way to add? Is there a need for expanding on the rules or regulations? It's clear.
Thank you very much, Excellency, Honorable Vice President, members of the media, colleagues. I think Your Excellency have highlighted the principal decision that has been taken to put Erongo under a lockdown and the measures that shall be in place as they have been enumerated by the Honorable Minister of Health. Just to highlight some of the key areas that we need to emphasize about the gathering, it is back to 10 for the entire Erongo region and subject to COVID measures to combat and to fight COVID. The movement of people from in and out Erongo are subject to permission or permits from authorized officers. And I just need to also emphasize here that between municipal areas or local authorities, there shall also be control measures that shall be put in place to control the movement of people. The operations of businesses, as we all know that in some areas, businesses have opened up. Now that we are back to stage 1, most of the businesses shall be closed except those that are providing critical or essential services. And restaurants and cafes shall only be allowed to operate on takeaway basis. Of course, alcohol is no longer allowed for the 14-day period. And of course, there is also an issue about keeping of register or a logbook by all businesses that are operating, that they shall be required to keep registers for purpose of tracing. Sports entertainments are prohibited, and also the gathering. Of course, in the past there were also some relaxation on seminars, workshops, and summits, so that has been scaled down. So if people are more than 10, that shall not be allowed. So with those few remarks, I just want to highlight that the more details shall be made clearer, either in the directives or in the regulations. However, I think those are the key areas that shall be highlighted in the regulations, and we urge people to comply accordingly. Thank you.
Thank you very much. Are there any questions? Yes, please.
Good afternoon. My name is Shalig and I'm from Eagle FM. Well, the businesses who are listed or who fall under the essential services, do they have to reapply to the Ministry of Trade for their permits to operate? And will government give relief to those who are now left, let's say informal traders? Will there be relief given to them as they are now restricted from operating? And when will COVID-19 related information be available in Braille? And are there any measures put in place to assist grade 11s and 12s to be up to date with the rest of the country, as they are also now restricted from face-to-face teaching and learning? Thank you.
Any other, so that we can answer? Any other question? Okay, only one.
Thank you very much. If I understand, your first question is where a permission can be obtained to travel. Is that what you asked?
No, Doctor. The businesses that fall under critical services, do they now have to reapply for a permit to operate? Because we know during the first stage where the whole country or Erongo and Commerce was under lockdown.
And in terms of the availability of regulations in other means, I would say that the point that Comrade President has just highlighted, I think that's something that we need to emphasize, that there has been efforts to go to different radio stations or to language stations to translate or to convey the regulations in vernaculars. So I think more efforts shall be put in place to ensure that at least that is done. As for the issue on the Braille, I think that's something that we can look into as we go along, but I think it's a valid point, and we will look into that and see how best we can accommodate that.
Any other? Oh, yes.
Good afternoon, Your Excellency.
Good afternoon.
Good afternoon, Vice President, the ministers. When the Walvis Bay lockdown was announced, Your Excellency, we had seen people fleeing the area. And now we expect the same with the Erongo Region announcement. Are the law enforcement and other authorities strengthening the measures to ensure that these are curbed? And then we also see with the ban on alcohol, there is a booming bootlegging industry going on. The last question, Your Excellency, is there is another disease that is rearing its head. That is racism. And we're seeing a lot of comments on social media, especially around, I guess it's to do with the situation in the United States, but maybe we could have a comment from you as well. Thank you.
I didn't. The first one is about the law enforcement agencies. Are they up to the speed? I think they should be. They are. We are planning this in tandem with the security wing of our government. So obviously, yes, if there are some problems because of distances, that's an understandable thing, but they are up to speed. As for the last question, I didn't quite get it.
Your Excellency, I'm saying there is like a new disease rearing its ugly head. That is racism.
Oh,
And maybe on social media, there's a lot of comments around how people are reacting probably to the situation in the US. Maybe just a comment or two from you.
well, racism, we fought against racism. That's not a question. Nobody can doubt us that after fighting against racism, that we'll sit and watch today in the United States, people still being killed based on the color of their skin. As you know, I grew up there, and in the 60s, there was a racial war there. And I would have thought by now, after they got the first black president, that now people can hold hands and move on. But one thing we must learn from American situation is that wherever there are demonstrations, who's leading them? White people. White people are coming out condemning racism, not like here. You so go and watch all the demonstrations. Some majority of people who are there are whites in some places. That's how you condemn in unison bad things, not just to sit back and look at. Learn from that. Go and watch TV, you will see whites are saying black lives are what? So when we say unite, if something is bad, not only one section must get up. I would have been disappointed if only blacks are condemning this. What is good about America is that white people are involved, even during the civil rights struggle. It's the whites who are leading it. So if something is wrong, let's all of us join hands and address it. On that note, maybe we are now finished. On the lighter, oh yeah.
My last question wasn't answered. I answered, are there any measures put in place to assist the grade 11s and 12s that cannot now resume face-to-face learning as the rest of the country's learners have resumed?
Well, face-to-face, teacher.
No, that's a good question. They are definitely, the students are definitely falling behind others. But that answer can only be given by those who are in authority in terms of the minister responsible for education. They are working on that, and together with the Ministry of Health, then we can see what we can do to make sure that also a formula is found for them to catch up with the rest of other students.
Just to add about only classes that started will be grade 11 and 12. Assuming that they can easily be controlled, they can space and so on. That's why that staggered approach is taken. That we are taking grade 11 and 12, a little bit mature. Others will have difficulty in distancing and so on. That's why they are going to be left until later on. Any other? If none, on a lighter note, I have heard a lot of music, my music, but there is no, what is it? Rights, huh? What is it? Huh? Property, no, not that. Copyright. So my songs that are being sung there, I need to be rewarded, please. Thank you very much.